If you're a man over 55, what I'm about to tell you may be the difference between living peacefully or spending the next decade battling prostate swelling, sleepless nights, and constant urgency. Most men think prostate enlargement is just age. It isn't. I'm Dr. Crisanto, a urologist, and today I'm revealing the 10 everyday habits that silently enlarge your prostate, starting with number 10, which almost every senior is doing without realizing the damage. If you've been waking up 2, 3, even 4 times at night, if your urine stream has slowed, if you feel pressure, heaviness, or the sense that your bladder never fully empties, these aren't random annoyances. They're signals, quiet distress calls from a gland that's being irritated every single day. The good news? Once you know the habits, you can reverse the damage. So, let's begin our countdown. Habit 10. Drinking too little water. Many older men believe reducing water will reduce nighttime urination. But the opposite happens. When you drink too little, your urine turns thick, acidic, concentrated, like a chemical broth that irritates the bladder walls. And when the bladder gets irritated, the prostate, sitting right beneath it, also suffers. Chronic dehydration creates low-level inflammation, one of the main triggers for prostate enlargement. The body also struggles to flush toxins, medications, and minerals. Everything becomes stagnant, creating friction in a system that depends on smooth, constant flow. Solution: drink small sips throughout the day. Avoid large glasses in the evening. Aim for pale yellow urine, your natural inflammation indicator. Water doesn't cause nocturia. Inflammation does. And hydration is your simplest shield. Habit 9. Sitting for hours. After 60, chairs begin to feel like old loyal friends, but some friendships come with pressure, literally. Sitting for long hours compresses the pelvic floor. That pressure slows blood flow to the prostate. Less circulation equals more inflammation. Men who sit extensively often experience weak flow, incomplete emptying, heavier pelvic sensation, because the pelvic muscles go dormant. A dormant muscle becomes a lazy muscle, and lazy muscles don't support the bladder properly. Solution: every 30 minutes, stand up. Walk for 2 minutes, even if it's just on the balcony or kitchen. This little movement acts like a gentle massage for the prostate, restoring circulation and relieving pressure. Your prostate was never designed for a sedentary life. Habit 8. Excess caffeine. Coffee is comforting, a warm sunrise in a cup, but too much of it turns your bladder into a restless drummer. Caffeine is a natural diet. It increases urine production, irritates the bladder lining, and stimulates the muscles around the bladder's neck. For men with a sensitive prostate, this creates a perfect storm. Urgency, frequency, leakage, incomplete emptying. Worse, caffeine tightens the smooth muscle at the bladder outlet. That tightening creates back pressure, exactly what irritates an enlarged prostate further. Solution: keep your morning cup. Skip the afternoon one. Try herbal tea or decaf after lunch. Your bladder will feel calmer within days. Habit 7. Eating spicy and processed foods. A plate full of flavor is delightful, but some flavors arrive carrying inflammation like a hidden passenger. Excessive spicy food, pepper, heavy sauces, especially eaten daily, can irritate the urinary tract. Processed foods are even harsher. Preservatives, dyes, refined oils, excess salt, all increase systemic inflammation, which the prostate is especially sensitive to. Salt increases fluid retention. Bad fats disturb hormone balance. Additives overstimulate the immune system. Together, they create a slow-burning fire inside the prostate tissue. Solution: you don't have to eat bland food. Just limit processed meals and heavy spices. Choose fresh meals, vegetables, fish, nuts, beans, foods that cool inflammation instead of feeding it. Your prostate prefers gentle flavors over fiery ones. Habit 6. Holding your urine too long. Every man has done it, waiting till the end of a TV show, delaying during a car ride, or ignoring the urge while busy. But the bladder is not a storage warehouse. When you hold urine for too long, the bladder swells like a balloon pressing downward onto the prostate. This constant pressure irritates the gland. Over the years, that irritation contributes to enlargement. Worse, Older men may not empty fully once they finally go. Leftover urine becomes a breeding ground for bacteria and inflammation. Solution: when your body signals, listen. Don't wait until urgency becomes discomfort. Your bladder and prostate work as a pair, protect one and the other breathes easier. Habit 5. Smoking or exposure to smoke. Tobacco is a quiet saboteur of prostate health. The chemicals in cigarette smoke do 3 things: reduce blood flow, increase oxidative stress, damage cellular repair mechanisms. That combination weakens prostate tissue, fuels inflammation, and accelerates enlargement. Even non-smokers exposed regularly to secondhand smoke experience similar effects. Solution: quit if you smoke. Avoid environments with smoke if you don't. Within weeks of reducing exposure, blood flow improves and inflammation decreases. Your prostate thrives on clean circulation. Habit 4. Avoiding doctor checkups. Men often ignore quietly worsening urinary issues. But the prostate doesn't always scream loudly, it whispers. Skipping annual checkups means missing early signs of inflammation, infection, abnormal growth, hormonal imbalance. A PSA test and a physical exam are simple, quick, life-saving. You don't need to wait for pain. Early detection means easier treatment and fewer medications. Solution: see your doctor yearly. Share symptoms openly. Treat your prostate like a long-term investment. The earlier you protect it, the better it supports you. Habit 3. Eating red meat too often. Red meat is nutritious, but daily consumption isn't ideal for senior prostates. Heavy meats increase inflammatory markers. Processed meats like bacon or sausages are even worse due to nitrates and chemical preservatives. Older digestion slows down. Red meat lingers longer in the gut, producing inflammation-promoting products. This leads to pelvic pressure, hormonal imbalance, increased prostate weight. Solution: eat red meat 1 to 2 times per week. Fill in the rest with fish, chicken, lentils, beans, and plant-based meals. Your digestive system and your prostate will respond with gratitude. Habit 2. Carrying excess belly fat. A growing waistline is more than a cosmetic concern. It's a metabolic alarm. Abdominal fat releases inflammatory chemicals 24/7, chemicals that travel through the bloodstream and collect in prostate tissue. Men with larger belly fat often experience weak flow, nighttime urination, reduced testosterone, increased prostate volume. Fat also presses on the bladder physically, intensifying urgency. Solution: you don't need drastic diets. Walk daily. Reduce sugar. Eat smaller portions. Losing even 3 to 5 kilograms noticeably reduce urinary symptoms. Your waistline is a silent predictor of prostate comfort. Habit 1. Most dangerous: not managing chronic stress. This is the habit men ignore the most and suffer from the longest. Stress releases cortisol, a hormone that, when elevated for months or years, inflames every tissue it touches. Chronic stress tightens pelvic muscles, reduces blood flow, disrupts hormones, irritates nerves, increases prostate swelling. Men over 60 often carry silent burdens, health worries, finances, family responsibilities. The body absorbs this tension and the prostate reacts. Solution: not meditation marathons, just small, healing rituals. 10 minutes of deep breathing, light stretching, daily walking, laughter, social connection, restful sleep. These simple habits reduce cortisol, relax the pelvic floor, restore circulation, and allow the prostate to repair. Stress is invisible, but its fingerprints are all over prostate enlargement. Closing message: positive, actionable, Dr. Tone. Now you know the 10 habits that silently irritate and enlarge your prostate. The question is simple: which habit will you change first? You don't need to overhaul your life in one day. Start with water, or daily walks, or reducing caffeine. Every small improvement reduces inflammation, supports hormone balance, and gives your prostate the chance to heal. Remember, age does not doom you to suffering. I've treated seniors in their 70s and 80s living with excellent urinary health because they made simple daily changes. Your prostate can improve. Your sleep can return. your strength can be restored. Just begin with one step today. Stay healthy, take care of your prostate, and it will take care of you.